Hello all, it's a great pleasure to have Dr. R.P. Soonawala with us. I'd like to welcome you, Dr. Soonawala. You have been a founder and past president of ISPAT. With your great efforts, ISPAT has been going very smoothly for so many years. But I would like to have some kind of memories and how we started and contribution of all our team members and founders for ISPAT.
Yeah. Human genetics is hardly 75 years old now, and it forms a very important part for the development of the world and the human race. Animal genetics, plant genetics, and human genetics. So the future of the world all depends upon how the genetics wants the world to go. I would like to say that in India we were not late, because as soon as you got to know that genetics was developing in Europe and the Western countries, immediately we had pioneers like Hema Purandarey, Amit Chakravarti and others who immediately started clinical laboratories to do the testing. And at the time the testings were much more simple and less invasive. Now the testing has become highly sophisticated and can be a little more invasive, so that a proper understanding by the doctor who is counseling that couple is the most important part that ISPAT aims to develop. The information in the public and the information in the medical profession that we can give, so that this science of medicine, which has a tremendous future for, a healthy human being, has to be understood by everyone. Heart disease, cancer growths, and all are nowadays shown to be genetically connected. And since the knowledge is getting better, our application of it and giving the public the benefit of it has to be our main aim. So counseling will be good if the doctors understand what the problem is and are able to transfer that knowledge to the patient and guide the patient properly. What tests are important, what tests are costly but may not be necessary to do. And for that ISPAT, which was started in 1989 as a get-together of like-minded doctors, mainly from parts of India, but mainly from Mumbai itself. And that organization slowly has grown and grown and grown. But our aim is not yet fulfilled. We want much more number of doctors, number of obstetricians and number of neonatologists to be members, so that if the organization has a large membership, it grows and this knowledge can be transferred more for benefit of the, say, human race. And I was lucky to get the opportunity to be the first president, but the pioneers mainly in our city were Dr. Hema Purandarey and Dr. Amit Chakravarti, who started a private clinic doing the genetic testing and all. There was a lot of misunderstanding in the beginning. Thank God that misunderstanding is gone. Because people misinterpreted that it was all done with one purpose, which is definitely not the aim of the organization. One of the informative ways that the knowledge can be transferred, because by meeting and getting to hear the learned speakers is one of the good ways of understanding what is genetics.
That's very nice of you to say all the things, Dr. Soonawala. And I completely agree. Without counseling the patient, without choosing right test at right time, many a times wrong information is passed on to the patient. Patients suffer for not doing the test, or sometimes because see the knowledge of genetics is comparatively it's not in the medical curriculum as yet. So we have to sensitize obstetricians more because of we rightly said that genetics is in every specialty and obstetrician is at the center stage. Because any problem with the family or the child when they are planning a family, they would say that we have got such and such history, we would like to have a normal child. But getting a normal child, to that there are a lot of things to be added, components, basically family history which is normally not taken by the doctor. So I always appeal to obstetrician that whenever you are taking history besides your medical history, is always better to have a family history so that you are able to pick up the disorders which they are not aware of or which can happen. Because individually genetic disorders may appear rare, but they are collectively more, and we are all are seeing in our practice, and with your blessings we will have a great
One thing,
success.
Hema, what I've seen in practice is a young couple having their first baby, at one time was not diagnosed at all. The baby would be delivered, and after the delivery they find anomalies. Some of them were so bad that even survival of the baby was impossible. And all the trauma, I at that time had couples who would refuse to plan a second baby
Absolutely.
because the trauma of the first delivery was so deeply rooted in their mind. And we had to convince them and win them over that there is a risk, we cannot guarantee 100%, but at least 95% we can say that the baby is normal, everything is all right. And if by chance there is an anomaly which is incompatible with normal life, we can then take proper advice, counseling by a couple of people, and may even opt for termination of that pregnancy, because there is no point in waiting 9 months, letting the baby be born and lose that baby. So if some proper guidance is there, this sort of unexpected abnormal pregnancies which are not compatible with a normal life, one can take some action to prevent that from progressing. So genetics is a very important part of life. Genetics is the future of the world. Everything that is done by world, going to progress in the world, eventually is connected with genetics, the plant life, the animal life, and the human life. And it is for obstetricians who want to practice a good, say, high-ended sort of obstetrics, or any institution which has got a good obstetric output or practice, has to have a genetic department, because now it's a question of not a one doctor could be a master of all, and
Absolutely.
and
Yes.
I mean, say jack of all and master of none. Everybody has to have a highly specialized vision, what they want to do, and specialize in that area. We will have much better care of our patients.
I completely agree with you, and with completion of Human Genome Project in 2003, it is not only the diagnostic tests at molecular level by genome sequencing we are doing, but also there are a lot of carrier tests which are available. So like we have carrier tests like we have for thalassemia, carrier testing for like predictive testing for difficult diseases like Huntington's disease or achondroplasia you detect. So autosomal dominant recessive disorders, by way of different levels we can offer carrier screening, predictive testing, and also we know BRCA1 and BRCA2 now it's very common and in obstetric practice. I mean detection is possible. Angelina Jolie was one of the Hollywood actress who had this family history, and she got her testing done, and she came out in the world. And honestly, everywhere it is, she came out and said every woman should get tested, because with that, you won't believe, but 95% of the genetic counseling practices went up. That is what it should be like. You have to come out in masses, you have to tell, you have to educate people at the, I would say, even grassroots levels. We have had several camps on genetics in rural area, and even these the workers which are there in the rural area who are picking up high risk cases and bringing, they were the first ones to give. So we had 5 camps. We had camps on congenital heart defect, we had camps on club foot. So in rural areas, I have taken more interest in rural areas. So rural areas, it was very beneficial. And now this knowledge, because see, all the samples can be transported, so it's not that patient has to be there. We have internet where we can communicate with each other, and we are one phone call away. So I think that it has got a great hope that we'll be able to reach to all the people, and with blessings of all of you senior people like you, like me also, I would say, we will be telling our obstetricians to go more into it and have at least basic knowledge. But it will open minds of many more obstetricians, like you rightly said, that they are the ones who will be taking this ahead. So thank you very much for giving your time. And is there anything, last few lines you would like to add? We'll be happy and to say.
No, just 2 points which I would like to mention. The way our country is progressing, the rural areas are getting diminished. Everywhere internet is available, a lot of medical aid, hospitals, primary health centers, everything. So the medical help also is spreading all over India, although 80% or maybe 75% of our country is rural. So that we have to think of that. And the second point which I would like to mention, which is very disturbing us, is out of about 38 or 39,000 FOXY members who are obstetricians and gynecologists doing obstetric practice, only 1,000 or less are ISPAT members. We wish that more obstetricians understand that if they can give proper counseling to the patient, especially any anomaly, and the risk of anomaly would be 1 in 1,000, if that proper counseling is given for that 1%, 1 in 1,000, it is 100%. And who is that unlucky one? We have to pick up, advise, proper line, how to progress, and mainly how to plan the second pregnancy so that the incidence is much more reduced. We cannot completely say that we'll be able to get rid of it. But in certain countries where thalassemia was rampant, like Greece, they have been able to control thalassemia incidence to so low that it is not a problem for the country. So that if there is a possibility of proper diagnosis, proper help, and reducing the incidence of congenital malformations in any part of the body, brain, head, neck, chest and all, that is in the infancy and maybe later on in elderly life too, diabetes, heart disease, malignancy can be detected by a proper genetic testing and accordingly given the right, say, counseling, how to progress or what to do. I thank you, Hema. It
Yes,
was very nice.
and just as you said, in Israel there are maximum Nobel laureates. In Jews, I mean, there are maximum Nobel laureates, but they also have large number of genetic disorders. They tried preventing it, and that percentage has come down so low. So they made it compulsory in their synagogues, giving lectures, talks, and then making people understand the importance of prevention by carrier testing. And now if you see like the severe disorders like Tay-Sachs disease almost come down to nil. So they always produce a certificate before marriage, yes, the carrier testing has been done. So that level the world is going. So starting at that level, In addition to that, I would like to now present these two books to you, Dr. Soonawala. So this is for physicians and non-physicians. This is about the history of genetics, the journey of genetics, and both these books I've given a lot of case studies in this so that people understand it better, and it's well appreciated. You will be happy to know that
I
this
will-
book received second Maharashtra State Science Award, and we got the news today only. But
I would really love to go through it, because knowledge is something you can never say, okay, you have completed your knowledge
yes.
development. Right from the time one is born to the time one has to leave, knowledge can be added every day by simple observation and reading. Thank you. Thank you very much.
Thank you very much.